Good day, everyone. Welcome back to my channel. Today we're talking about eclampsia and how to recover from eclampsia. So, what is eclampsia? Eclampsia is when a pregnant woman with preeclampsia develops seizures, or you can say eclampsia is a seizure that occurs with women with preeclampsia. Now, not all preeclampsia can lead to eclampsia, but it is rare, but can be quite serious. Not all preeclampsia can lead to eclampsia, but some do lead to eclampsia. Eclampsia may occur during antenatal, during labor, or between 1 or 6 weeks after delivery. It is known that the nursing of an eclampsia patient is done in a dark, quiet room to avoid further stimuli. Now, let's talk about the risk factors of eclampsia. The first risk factor of eclampsia is being pregnant with more than one baby. Like when a woman is pregnant with twins or triplets, it can lead to eclampsia. Another risk factor is conditions like obesity, diabetes, or family history. When a pregnant has family history, personal history of preeclampsia and eclampsia, it can lead to preeclampsia and eclampsia in the new pregnancy. Now let's look at the symptoms of eclampsia. It's similar to the symptoms of preeclampsia like we discussed before. Symptoms like severe headache, difficulty in breathing, blurred vision or loss of vision. These are symptoms of eclampsia. So when a pregnant woman is having these symptoms, it is better for her to meet her doctor to avoid complications. Now let's look at how eclampsia can be diagnosed. There are three ways of diagnosing eclampsia. There is a blood test, there is urine test, and there is a creatine test. Now, the blood test helps to show the level of platelets in the blood. If the platelets are low, this signifies that there is preeclampsia. And when there is another test is the urine test. When there is high levels of when there is high level of protein in the urine, it signifies preeclampsia and eclampsia. And the third test, which is the creatine test, this test shows the level of protein in the kidney. When the levels of protein in the kidney is high, it shows that there is eclampsia. It shows that eclampsia might occur soon, of which it should be taken care of to avoid that. Now let's talk about the management and treatment of eclampsia. The first management is using of anticonvulsant medicine or magnesium sulfate infusion, which helps to prevent seizures. So when a pregnant woman who has preeclampsia starts to develop seizures, which is the eclampsia, it is better to use infusion like magnesium sulfate, which will help to reduce the seizure. The second management of eclampsia is using antihypertensive drugs to help to bring down the blood pressure. The third management is using of corticosteroids, which helps to develop and strengthen the fertile lungs. Now, let's talk about ways of preventing eclampsia. The first way of preventing eclampsia is getting treatment for preeclampsia. When a patient who already has preeclampsia starts to get treatment for it, it might help to reduce the risk of eclampsia. The second prevention is using of supplement like calcium lactate, which helps to reduce the risk of eclampsia, and also eating healthy diets. All this leads to all this can help to prevent eclampsia. Yes, something like calcium lactate and using a low dose of aspirin in the first trimester of pregnancy can help to reduce the risk of eclampsia. And let's talk about the effects of eclampsia to the baby. It can lead to placenta abruption, it can lead to stillbirth, it can lead to premature deaths. These are the effects of eclampsia to the baby. It can also lead to low birth weight, whereby the baby is underweight. So it is better to treat eclampsia when it is early than when it gets to the point whereby the woman is having seizures. Now, how to recover from eclampsia? There are different ways of recovering from eclampsia. Number one is taking hypertensive drugs properly. When a woman is taking her drugs properly, it will help to reduce the risk of having eclampsia again. And another way of recovering from eclampsia is eating healthy diets and taking care of her body properly. When a woman is eating a good diet, it will help to reduce the risk of having eclampsia in a new pregnancy. These are ways to recover from eclampsia. Then now, finally, I would like to add that eclampsia may not be rare, but it can be quite serious. So when a pregnant woman notices symptoms like vomiting, blurred vision, difficulty in breathing, it is better for her to rush to her doctor so as to avoid complications. So I urge all pregnant women out there, make sure they take care of themselves. Any symptom that you notice that is not okay, rush to your doctor. Other symptoms that are quite serious are vaginal bleeding, or when a lady doesn't feel movement in her stomach, doesn't feel the fetal movement like how she did before. It is better for her to go and meet her doctor. So thank you for watching my video. Please like, comment and subscribe for further notifications of my video. Thank you so much.